Hello and welcome to Satellites in Public Health, a webinar presented by Space and Satellite Professionals International, or better known as SSPI. My name is Robert Bell. I'm Executive Director of SSPI. And in case you don't know us, we have been since 1983 connecting people of this invisible, yes, it's invisible for the most part, indispensable industry called space and satellite. Today we consist of about 3,000 individuals and north of 50 corporate members whose support is essential to carrying out our mission. And that mission is twofold. First of all, we are really here to connect, as we have been since the beginning, a network of people in the industry, both for their individual professional growth and also for business development. And their support contributes to two major campaigns, one of which is called Making Leaders, and that one is about helping this industry do a better job of attracting, of developing, and retaining the talent in all kinds of areas not necessarily considered traditionally part of satellite, that are essential to our future, and sharing the lessons of executives who have pioneered in new fields and developed new technologies and led organizations in very powerful ways, as well as those of executives who are starting out on the path and already accomplishing amazing things. And our other major campaign is called Better Satellite World. And this one aims squarely at a strategic problem the industry has, which is that it is, despite its immense contributions to the world, very largely out of the headlines, out of the news, and invisible to most people who are not already doing business with it. And that's a big problem for the industry in terms of its ability to attract investment, its ability to attract a new generation of customers, and its ability to attract and retain a new generation of employees to carry it forward. So by working on these two campaigns together, we're helping this whole industry step forward. I need to thank the corporate members of SSPI, because the reports, videos, podcasts, webinars, and events that we put on are made possible by their support. And they include Airbus, Eutelsat, AVL Technologies, Hughes, OneWeb Satellites, Planet, Periton, ST Engineering, SES, and many, many others. So today, thank you very much for joining us. Our agenda is straightforward. After the welcome, which I'm nearly done with, and our webinar agenda, I'll have some housekeeping details for you, a very brief introduction to our topic, and then we'll get to the real interest of the morning or the afternoon, depending upon where you are, which is a discussion with our very distinguished panel. And finally, we'll close it out in about an hour's time. Okay, satellites and public health. This topic actually began as the headline story for an issue of our online digital magazine that we put out once per quarter, The Orbiter. Satellites and public health, of course, was brought to us for a very simple reason, because we were all thinking about the response to what is the greatest public health crisis in living memory, of course, the COVID-19 pandemic. And as we worked on this particular issue and began to solicit contributions from a wide range of very accomplished people, we gradually began to realize that, of course, satellite, the question you have to ask is, what does satellite have to do with COVID-19? Isn't COVID-19 about masks and social distancing? Isn't it about the hunt for a vaccine, about how we can treat this better than we currently are treating it? And the answer to that question is, of course, yes. But if you peel the onion a bit, you discover that satellite, since its inception, has been playing a very, very large role in keeping the public safe because of its ability on a global basis to make communications happen, to track locations, to sense remotely what's going on planet Earth. And so we're going to be exploring some of those ways in which satellite has been making essential contributions to public health in ways that you may not even be aware of, in spite of the fact that you probably are inside this industry and working in it every day. And it is now my great pleasure to introduce the people who actually are the experts on this topic. To begin with, they are Matt Desch, who is, of course, well known as the CEO of Iridium Satellite. Matt is also a proud member of the Space and Satellite Hall of Fame, into which he was inducted a couple of years ago, and we're very glad to have him with us. Joining Matt is Valvanera Moreno, who is the Senior Manager and Program Integration Lead at SES, And she, a couple of years ago, became one of our, was identified as one of our 20 under 35, a set of younger executives in our industry that we believe, based upon the information we have about them, are people to watch in the coming years because of how much they will be accomplishing. Joining them as well is Dr. Walter Scott, who's the Executive Vice President and Chief Technology Officer of Maxar, also one of the co-founders, of course, of Digital Globe, now part of that company. And Walter was also, several years ago, inducted into the Space and Satellite Hall of Fame, where we're very proud to have him. And finally, Robbie Schingler, the co-founder and Chief Strategy Officer at Planet. And Robbie, I would love to be able to put one of those little medallions down below your name, and that may very well happen sometime in the future, but it hasn't happened yet. So welcome all of you to our webinar. And if you are successfully unmuted, we're going to dive into some questions for you. The first question I want to ask all of the panelists is sort of if you will, a framework setting one. When disease and disaster strike, as we are now unfortunately too experienced with, they turn upside down the ways that we live, the systems that support us. We lose capabilities, we face new risks, we need new kinds of help. So what are just some of the ways on a sort of top level that satellite contributes to those solutions? And Walter, let me start with you just for fun.
Sure. So in the current COVID crisis, you've got worldwide impact, and there are places in the world that are not nearly as well mapped as the urban areas in the West. And an example of that is Malawi. So ID Insights, which is a Gates Foundation grantee, they're working with the government of Malawi to do cash transfers for urban households. That's part of their COVID-19 response, given that one of the impacts of COVID, in addition to public health, was obviously the economic impact. And what they're doing is using satellite imagery to estimate the number of households in the various communities that are going to receive the cash transfers so that they get the right amount of money to the right people and they avoid fraudulent households registering. So they have a mechanism for effectively looking from above to identify where the people are to get the cash to them.
Of course, and having cash, having a livelihood is actually a major contributor to public health, as we are now finding out to our cost.
Indeed.
Yeah. Valvanera, what in terms of from where you sit, what are some of the ways that satellite contributes to public health solutions?
So my angle is from the connectivity of satellite solutions from a CS standpoint. I think the two main ways we contribute to solutions is the fast response time. So there are rapidly deployable terminals that we can bring to disaster areas, or in this case disease, wherever the needs occur in a fast way. And then the reachability to remote places that satellites can get to, and no other technology can, especially not in a fast way, because satellite infrastructure is already there in the time of need. So then connecting the dots makes us unique in this environment.
Interesting, yeah. Speed. We'll talk some more about that in a moment. Matt, now this is interesting to me because, of course, SES is in the, if you will, the wideband business, or has been in the MEO business. Iridium's always had a very distinct business model. What are some of the solutions that some of the ways in which you see satellite contributing to public health?
Yeah, thanks, Robert, for putting this together, and thanks everybody for joining. Iridium was created almost 30 years ago, or the vision of it was created to provide connectivity in remote places, and in fact 100% of the planet. And our coming out party really was in 2005, while we had been in service for a while, when the hurricane hit Katrina. For 250 miles around, I don't think anyone appreciated how fragile the communication systems were on the ground to natural disasters. They know that now, thanks to Rita and tsunami in Japan, and Puerto Rico and Houston more recently, and many other places. And in the first few days of that, typically, after communication systems are down, you have a serious public health emergency because it's a life or death situation, not just to save people, but to take care of their safety, their health, etc. And a mobile system like Iridium has been very important in those first couple days, and eventually other satellite systems like Valvanera's are rolled in for much more broadband capability. But having a mobile device that can connect the governor to the airport to the first responders in the field is really critical to finding people and getting them to the hospital and taking care of them. But it expands beyond that way to so many other applications, which I'm sure we'll talk about.
Yeah, absolutely, yeah. Once saw a very scary animation put together by Fuji TV showing how all of its camera positions and all of the cell towers in, I can't remember the name of the town now, in Japan, just got wiped out one after another as the tidal wave, swept across the city. And it was just, it was so graphic to talk about the vulnerability of terrestrial infrastructure. Wow. Robbie, we'll just bring you into this. Of course, you are also in the remote sensing business. So what are the contributions that you see from satellite?
Yeah, thank you. And thanks for bringing this panel together. I think from satellites in general for public health, we talk about connectivity and remote sensing, and also in connectivity is combining remote sensing together, and that's with IoT and much greater data. And so often we, in the broader public, we get to see a disaster. We get to see that picture. But in reality, in this risk industry, risk space, there's a lot that our sector does. We help to model disease and potential outbreaks. We can use remote sensing data to monitor how things are moving along and if things are emerging based on observed patterns of changing risk, then that could get toward people to prepare for a potential response. And then there's the actual response itself. And that's when speed is necessary and when people need to have the same common operating pictures of the facts on the ground. And that helps with coordination and supply chain logistics. And then it's also remote sensing supports in recovery. So being able to see how society is responding and adapting to some of these natural disasters or a public health outbreak. But importantly, now that we are going through a massive sensor revolution over the last decade or so, we're beginning to see correlations between one event and another event. These near adjacent spaces where COVID intersects things like food security or wildlife risk. And there might be other indications and warnings that things about to happen, which then feeds back into a better model for monitoring. But it also allows for us to understand how interrelated some of these complex effects are and how it affects the ecosystem, in one case from illegal mining in Peru, and then what that does downstream for vulnerable populations.
That interrelatedness and the preparation are two themes that I personally have taken away from the current pandemic. We're obviously in the United States, we obviously have been woefully unprepared. And yet so much of maintaining public health is about those two things, understanding the interrelationships and being well prepared. Walter, some of you offered very specific examples of, if you will, what did Matt call it, the coming out party. Valvanera, I don't think you managed to do that. Could you give us a specific example from SES in terms of something that you've done with that immediate response capability?
Yeah. During COVID-19, we've had a team that's been looking at kicking off several efforts. My favorite example is the extra free capacity provided by a satellite called SES-10 over Mexico. We're connecting 35 hospitals in collaboration with the Mexican government and Telecomunicaciones de Mexico. And this is connecting the doctors of different sites, allowing them to share videos, data, and to be really collaborating during the pandemic. So it's a very good effort, and I would say very useful for the hospitals and the people over there.
Yeah, interesting. And Robbie, is there a specific example that comes to mind to you of planets, space data making a difference in public health in the broadest sense of public health?
Sure, yeah. This does happen all the time, and sometimes it's not intuitive that it comes up. Just last week, for instance, the World Food Program in Rome, they were tracking an Ebola outbreak in a remote corner of the Republic of Congo, and they were concerned that this outbreak had shut down a local food market and that there could be a food security crisis. And we were able to determine that the market was still functional and helping World Food Program and local aid and public health agencies coordinate their response. And so again, getting people with the same facts, timely information allows for people to then either stir up a major response or actually understand the stats on the ground and help calm a particular solution.
Thank you. Yeah, it's it's funny. Each of you has referred to something sort of that's been implied in what you said. Valvanera was probably the one who put it out most there. But one of the things that satellite's always been good at is the ability to react fast because of its unique geographic reach. Whether you're talking about tasking a sensor in orbit or delivering connectivity, thinking about it, what kind of difference does that make in the field? Right? I mean, why is speed such a big advantage in any kind of public health emergency? Matt, you talked about it with Katrina, the ability to make that call. What are some of the things that it really contributes to?
Yeah, well, it's typically life or death situations, so speed is going to be often the difference, whether someone lives or dies in some cases, or whether the recovery can happen quickly. I mean, but even recently, with COVID-19, we've seen, for example, drones have become very valuable. It used to be bush planes going into remote environments to take medicine and vaccines and take samples, COVID samples, but now they're starting to use drones long distance. But, in those places where in Africa, we mentioned Malawi is a good example where we have one Swoop Arrow is doing this, one of our partners, or Zipline is another partner doing this. They need a command and control system to know that the medicine's actually getting where they need to go and to retask it if necessary. And so having a satellite data connection to a small vehicle can get that medicine into that remote community or get those COVID samples out where it might be days or longer before they could get a pilot in there and get someone to respond to it. So it can be really critical. And we're finding, like in these emergencies where flooding and that sort of thing, you find someone in a house, you really want to coordinate with a hospital right then. You can't, and there is no cell phone connection. Satellite's the only way to do it. So there's tons of examples. I will say one of the other ones I really like right now is, we're on lots of ships. We're on probably 20, 30,000 ships providing crew calling. But when COVID hit here in March, we realized a lot of those crew don't have a lot of money and they're really worried about their families, their ability to call home and check in and make sure everyone was safe, was really critical. So we gave out lots of free minutes to each of those ships just to help provide security and peace of mind. And there was a business reason too. It didn't hurt that they got to experience the better quality of the new satellites that we had just launched in the last year if they hadn't done that. So it's a reminder of the value of the service, but I know a lot of them really appreciated the fact that they could check in on their families during tough times.
Well, that's my favorite kind of outcome, doing good and also having a good business reason for it. I mean, that's perfect. Yeah, it's interesting. There's a corporate member of SSPI that has an application for, I think it's the Red Cross, where they're doing basically the same kind of thin route IoT for vehicles, and it's mostly designed to keep their people safe because they're obviously working in some very difficult areas. You know, and so it's public health, but you have to protect the caregivers. Is something else we've learned from COVID.
That's right. I mean, you know, in our case, IoT shrinks down to the, you know, being able to carry in your pocket or, you know, sewed into your. So we see a lot of health officials using tracking, because a lot of times these health and public health issues happen in very difficult environments and difficult places, and the fact that you can kind of have an emergency button on someone that can easily be pushed, a battery powered device that could last for days so that they're not worried about powering it, and that you can keep track of all your first responders in real time, or your healthcare workers as they move through a difficult environment. That's a perfect thing for a satellite system, particularly if you don't have a terrestrial wireless system. And even if you do have a terrestrial wireless system, a lot of times you have outages or coverage gaps or whatever, so you end up marrying the two technologies to great effect.
Yeah. Now the case for instant or extremely fast response, and we actually did a Better Satellite World video about SES's work with the Luxembourg air taxi service, and about the fact that they have managed to get their magic inflatable antenna into some really tough places with incredible speed to provide connectivity. But over in how about in the remote sensing world? I mean, where does that same kind of speed make a big difference? Walter, you want to take that one?
Sure. So I guess there are a couple of areas that come to mind. Certainly one of them is tied directly to public health. So in May, the Philippines got hit with Typhoon Vangfang, and the problem after any kind of a natural disaster is, you know, just like the example you were using of the tsunami, what was there before often isn't there after. And so being able to get a picture of what's on the ground after a disaster is essential for being able to send people to the right places, and also to be able, in this case, since May was after the COVID outbreak, to maintain social distancing and limiting the spread of the virus. So being able to rapidly assess, okay, what is there on the ground right now, as opposed to what was on the ground beforehand. Another example that's maybe not directly a public health in the virus sense, but it's a fast reaction is, you may remember that at the end of 2019 and beginning of 2020, Australia was having record-breaking temperatures, months of drought, and it fueled a series of huge bushfires across Australia. And in one of the worst hit states, New South Wales, the fire was hitting something like 5 million hectares and destroying 2,000 houses. And so this is an example of where satellite provided a unique capability, which was the ability to see through smoke. This is one of the Maxar satellites. WorldView 3 was able to provide rapid response by being able to look through the smoke and identify, you know, where the fires were, burnt areas, and so forth. So I think overall it gets to satellites in places that are either dangerous, because in this case there was a fire, or where it's hard to get an immediate response to, like after a typhoon. Satellites can be there right away to provide the information that's needed on the ground.
Yeah, I've seen videos of in some disaster sites, you know, rescue or recovery workers walking from house to what used to be houses, between, you know, along streets and so forth, recording on their phones or their, well, PDAs is pretty old, you know, what the conditions are. And you realize it's very easy for us to forget what an incredible advance it is to be able to look down from the sky at relatively high resolution and get the answer right now. So yeah, it really is fairly miraculous. Robbie, what about you in terms of speed? You even talked about the fact of kind of getting there with the information before the disaster occurs.
Yeah, I think this is relatively a new type of science within our community, which is really time series analysis, and taking a large amount of data, just a whole bunch of pictures, and being able to extract the features that statisticians believe actually are the leading indicators for something about to happen, and then track that over time. And if you have like a whole bunch of data and a whole bunch of history, that becomes training data and information that allows for modelers to then look for these indications and warnings that may not seem obvious, but are connected in a complex system. And then when it comes to speed, it is being able to be pushed some information that there is a warning, and that allows for then us to galvanize up our preparedness if something is about to happen. And so all the examples that connectivity gives us for real-time information, all the examples that Walter is saying with respect to the special ability of satellites to be able to see whether at night or through clouds or smoke, and having enough satellites overhead so that you have one there when you need it. That I think is right straight down the value proposition of satellite supporting public health and natural disasters. But when you combine that with IoT, with a whole bunch of other data sets, with cloud computing, machine learning, statisticians are getting much greater insight into the state of the world as it is developing and happening. And we're at a point where over the next few years, I think that local communities and nations will be in much greater, better position to be prepared to then have community resilience, which is mainly what first responders are when it comes to anything that does happen that is a surprise for society.
I think it's a really good point. Something that I think most people are not aware of is the very large institutional structure that exists around emergency response, but also public health. And by the way, I tend to think of, responding to natural disasters and diseases and lack of sanitation all being basically the same, set of public health issues. But there is this large infrastructure, and it's working very hard to prepare for the next disaster, which is why we're getting slowly, despite the surprises that COVID has thrown at it, we're slowly getting better at this. So I'd like to talk a little bit about the way in which satellite is not just about responding to the thing after it's happened, but let's extend that. I mean, public health is, of course, also about vaccination campaigns. It's about water. It's about sanitation. It's about maintaining contact with remote locations, because communications is essential to both economic and human welfare concerns, monitoring risks, as you just mentioned. So where are some of the places where our satellite services and communications and sensing are having a real impact on that? Valvanera, you want to lead us off?
Sure, yeah. So I would say, again, on connectivity, satellites make huge difference in people's lives in these times, but also before that. Being able to be connected with your loved ones, being able to support each other even when you're physically separate, contributes as well to the mental health aspect of things. And obviously as well on the capability to be resilient against emergencies of this kind or other kinds. So I believe that, as an industry, we have a spotlight on this area, and a sense of duty, at least personally, I feel it that way, to be there from the start before, whenever there is no emergency still, but, just be ready to be able to support those communities everywhere in the world.
I don't know. Why don't we hear from Matt in terms of this ability to contribute to the ongoing business of safeguarding the public?
Yeah, well, our new satellites were launched with a couple hosted payloads on them, and it's interesting. They have sensors to do some things that maybe we haven't kind of talked about before. One of them is able to track every airplane in the world, as they broadcast their position second by second, and that was, as a business, that was meant to give air traffic controllers, better visibility to airplanes and provide better routes, but it's turned out to be kind of a lifesaver too. I mean, I love the story. I guess not long ago, there was a small single engine plane over the Caribbean that lost its engine and reported an emergency, and they dispatched a helicopter, but he fell below the radar after he got below a couple thousand feet, and they were going the wrong direction, except that they called our partner Ariane, who provides that service, and they told him exactly where he ended in the water. The helicopter went to that place where the airplane had already sank, and the pilot, who didn't have anything, was treading water. So you can imagine that wouldn't have gone on much longer, and was saved, and a good day happened. So maybe that's a little bit back to your speed is important here, because that just wouldn't have happened otherwise. And there's a whole bunch of those that they've been having, where they've been rescuing people. They even have this alert center where anybody kind of registered can call in and find out where their airplane went. Another sensor is for tracking ships in real time. It's the first time you really know exactly where every ship is, because they can see the AIS connections. Before, that was sort of done where satellites would go over occasionally and get a location, and then you kind of interpolate where ships are. But things happen, to ships in real time. We're introducing a new service here for maritime safety that kind of came out of the Titanic many years ago. That there's a big red button on every ship that when you push, people come to rescue that ship immediately, and it gets sent to all the ships in the nearby area. And it's not exactly public health, but you can imagine these are critical, emergency, important conditions that if you didn't have a satellite connection, you just wouldn't be able to respond in those kind of ways. So sensing information, I think, is real important, especially as satellite IoT gets put into everything. We're going to start seeing really connectivity to just about everything everywhere in the world, and that's just going to create a lot more awareness about where things are, what their status is, and when people are in trouble or sick or unsafe, it's gonna create a connection that will benefit them.
All right, so you're describing an invisible network provided by these services that is, again, increasing the safety of everything. Before the AIS for airplanes came into place, I was stunned one year to realize that when I was on an airplane crossing the Atlantic, as soon as I got out of radar range of North America, nobody actually knew where my aircraft was. I thought,
well, they knew roughly where it was, Robbie.
Yeah,
they didn't know exactly where it was.
Exactly. They knew where it was supposed to be. That's a little different. We've got some, actually, let me just finish. We'll finish with this question, and I've got some great questions coming in from our audience here. So the subject is contributing to the ongoing business of keeping people safe. Robbie, let's turn to you. You've had a couple of interesting examples already. What else can you offer us?
For keeping people safe?
Well, just you've been talking about the issue of, in fact, Matt just gave us a great description of the way in which these new satellites, relatively new satellite services, are basically getting out ahead of potential public health issues, potential issues. And so, how can we do that increasingly?
Well, I think I think this is probably good to talk about, like, the need for strong partnerships. Most of the things that have had the greatest humanitarian impact, or the greatest contribution to understanding of these indicators of things, really come through people that have devoted their lives to this. So whether it's in the UN or the World Bank, the World Food Program, or nonprofits, and again, every day I get increasingly surprised as to how our sector can help to better understand our planet. So, a good example that's also in public health is we're partnered with a group called the End Fund, and they coordinate field campaigns for public health workers who are trying to tackle neglected tropical diseases in several countries, and it turns out that these tropical diseases like river blindness are transmitted by parasites through fast-moving rivers, right? And our technology can determine both when the rivers are flowing and where people are living nearby. And so with us as technologists and with the End Fund as being like on the ground, really understanding the science behind it and understanding the communities to which they are embedded, it really does allow for these really unique applications that have real world public health utilities. So to back up a second, as our sector, especially remote sensing, makes the tools from the data more easily accessible for more factors or more sectors of society, we're beginning to see more and more use cases where people are using data and facts to help drive informed decisions and come up with unique insights for things that allow for us to be better prepared.
Gee, basing decisions on data and facts, that's, you better watch out. People are going to have trouble with that idea, Robbie. Walter, why don't you finish up this topic for us with this issue of how we get out ahead of the next set of threats to human life?
Sure. Well, I think what I'll do is use an example about vaccination. So here in the developed world, you want to get a flu shot, you go down to your grocery store or your pharmacy and you get a flu shot. But in large parts of the world, that isn't possible. And several years ago, we supported the Gates Foundation in mapping big chunks of Africa to enable the distribution of polio vaccine to remote areas by identifying where people lived, approximately how many people there were, so that the right amount of vaccine got delivered to the right people. Well, think about the current situation. We don't have a vaccine for COVID right now, but we are certainly hopeful that one of the many efforts that are underway to develop a vaccine will be successful. And so getting that vaccine out to the right people at the right time is essential. And that's an area where satellites having the ability to map the entire planet, whether it's easily accessible on the ground or not, provides the infrastructure so that that vaccine can get out quickly so that we can stop the epidemic.
Absolutely. Absolutely. Mapping is incredibly powerful, and it's, again, highly unappreciated. Some questions from our listeners. One of the ones I liked was talking about the issue of when we think of satellite services, we very often think that it's basically something gets channeled through government. And I think that's particularly true in remote sensing. We tend to think that it's government buying everything. What are the applications that are for satellite in private sector health services that, again, are designed to help out designed ultimately to address public health?
I can take a stab at this as Walter. So you probably know that Maxar, in addition to being in the remote sensing business, also built satellites. And so telemedicine is, particularly these days, quite important in the need for having communications capability, broadband communications capability. And I'll focus on Indonesia. So Indonesia is more than 10,000 islands. It means that trying to build fiber out is nearly impossible. And so you've got many remote islands and villages that would have no access to the internet without the ability to use satellites. And so Nusantara Satu is going to be providing high-speed internet to public health sector, education sector, individual physicians to allow for communication across that entire area. And you start thinking about across the rest of the world, public health is not always a government function. Oftentimes it's individual doctors who have the ability to access the internet to get to their patients.
Absolutely, absolutely. Valvanera, how about you? Because of course in SES's business, a huge amount of it is directly to business and commercial users.
Yes, so definitely fully agree with Walter. Bringing broadband connectivity to remote places is something that in the private sector we work with, not just government, but private companies, and obviously for health sector, hospitals and others. But also another angle of this is as well broadcasting of some channels that might be helpful in, education channels and even mental health, with the goal of mental health, not just entertainment. So SES as well contributes on that. From that perspective, that supports all this ecosystem of tools of health that we need in these times.
Yeah. One of the most impressive examples of mental health care via communications I ever saw was actually terrestrial, but it was in a rural county in Canada in which before the system was put in place, nurses would and healthcare workers would get in their cars and drive, miles and miles or kilometers and kilometers, and be able to visit 3 or 4 patients, a day perhaps. And then they installed a telemedicine system, and they were able to see 10 or 12 patients a day. And when they asked their patients how they felt about having this remote connection, and whether it was demeaning or depersonalizing, the response was no. Having my computer sitting there, knowing that you can connect me, makes me feel like somebody's on my side. Oh, and I just thought, wow, what an impact. And of course, I'm sure that's being delivered by satellite as well.
Yeah, it definitely makes me really happy to contribute to that.
Well, exactly. Hence the Better Satellite World campaign. Matt, do you have anything you want to throw in on that?
Well, I mean, I think when you're talking about individuals, individual public health agencies, I think telemedicine is sort of the example, and we're being used in a lot of places for doctors in remote places to be able to get help, and with the new technology, still being able to develop small devices that can do higher speed data with these new satellites. We're starting to see people talk about applications of sending pictures back and forth, video. Obviously, you can set up satellite to send high-speed video, but doing it on a very mobile basis is what more our business model is about. And we do see interest in public health agencies to do that. The other one is, of course, air ambulances is a big thing. We're used in thousands of rotorcraft for connectivity, but a lot of these ambulance services are like multi-state areas, and not just being able to track where they are, but to retask them to go to specific areas to pick up someone in danger, and track them on the way and send information back and forth while they're moving. You use cellular if you could, but as soon as you go up 1,000 to 2,000 feet, networks aren't built to handle aircraft and rotorcraft. So satellite is the way to connect those things, and those are all private entities as well, usually.
Yeah, absolutely. I'm going to move on to some other questions because they're really coming fast and furiously here. I thought that was an interesting one. Another interesting one is, and boy, I don't know the answer to this question even vaguely, but contact tracing is, of course, right now a very big topic. It's 2 words that most of us didn't even know a short time ago, but we certainly know it now. Does our industry have a role to play in contact tracing? That's a question for anybody who's got an answer.
I think only more from the remote environment as a replacement to cell phone connections. Clearly, if you're in a small community or something and you find out that and it's remote or something, and you find out that someone is sick and they've come in contact with someone from another nearby community, sometimes satellite devices are the only way to make those connections. Not really sure of other aspects of that.
I think there's a really straightforward one, and it's completely invisible, and that's how do you know where the phone is? GPS. GPS is provided by satellite. That provides you with the location information that is foundational to being able to do any kind of contact tracing.
Yeah, I think you're absolutely right. We did a bit of Satellite World video on the effort to eradicate polio, and GPS equipped phones ended up being critical to the effort. So it's very interesting. And here's a question I'm going to ask you, and I don't even understand what I'm about to say. It's a question for both Walter and for Robbie. It says, may you both put share some insights on handling the spatial co-registration issues in the temporal dimensions and sometimes also in the concurrent data sets from the same satellite having two different payloads. I hope that you gentlemen understood something about that.
Sure. I don't know, Robbie, do you want to take that first, or I can? Either way.
Sure, absolutely. So the question is really about, if I could rephrase it, is we're in this huge proliferation of having many satellites in space that are taking pictures of our planet, and traditionally this has been done with one satellite or two satellites. So the information has been scarce, and the processing of taking the picture from space, then processing it via a computer for you to then get the insights is a fairly scientific and specialty process. But fortunately, over the last decade or so, last 5 years especially, there's been a lot of research in the academic community and a lot of technology and cloud computing and other types of feature identification that helps with, as the question asked, co-registration. And being able to have interoperability between diverse data sets. And so this is absolutely a challenge and an opportunity for our industry. So at Planet, we've launched about 400 different satellites in space over the last 6 years, and they have different degrees of quality to then capability. And so we've had to work hand in hand with remote sensing researchers to then make it seamless for our users, that it doesn't matter which satellite it came from. They just got the information that they needed. And so we will see a lot more of this in a global community. There are new web standards for remote sensing. One is for instance called, well, we don't have to go into it, but you can look up stack and cogs if you're interested in some of those things. But then also getting toward a more enhanced data process that is a bit synthetic, where it's a combination between various data sources that then give you an insight that no one picture could have done. So it is a challenge, but perhaps it's one of the greatest opportunities for us to bring geospatial to the web and allow for small businesses and civil society and people who don't know remote sensing to make sense-making applications.
Well, thank you, Robbie. Walter, have you got anything to add to that? Because if not, I want to move along. That was a very specific question.
Yeah, so I have a very specific answer. So the world is not flat. The world actually lives in 3 dimensions, and terrain or perspective angle from a satellite actually matters to try to align one sensor to another. And for those of you who follow the news, Maxar recently acquired the remainder of our interest in a joint venture between Maxar and Saab called Vricon that builds out very accurate 3-dimensional models of the surface of the Earth. And we use that technology for co-registering sensors, whether it's drones or other satellites, to accuracies that are better than 3 meters, so 3-meter absolute accuracy. Additionally, we've extended the co-registration technology even further, and for applications like self-driving cars, we're able to get positional accuracies that are better than 1 meter absolute accuracy in terms of where an image is located on the ground. So it's you know, as Robbie says, it's been taking advantage of a lot of work that's gone on over the last decade or so. And we're able to achieve now co-registration accuracies that are pretty much at about the limit of what the sensors are capable of.
Okay, thank you. So I hope our audience member who asked that question feels that he or she has gotten a very sound answer. We're coming up to the last 9 minutes of our time together. And I just want to ask the panel a question which I think underlies a lot of what we've been talking about. Many of the diseases, the disasters, the conflicts, which are also a source of terrible threats to public health, and the mass migrations that arise from those conflicts and from natural disaster, they're all basically a result, or their increasing speed and impact on us is a result of our changing climate. And I'm just curious if you can talk about how satellite services are contributing to both our understanding of that climate change and also to management of its effects. And I think I'm going to start with our friends in remote sensing, because they're the ones, of course, who are going to be talking about understanding that climate change particularly. So Robbie, you want to address that?
Absolutely. So if we look at remote sensing and the history of that, it really has been for scientific purposes, with starting with the Landsat program back in 1972, or on one hand, and on the other hand, more surveillance and reconnaissance for intelligence purposes, starting with the first flights with Corona with NRO, but over the last 50 years, technology has really accelerated quite a bit. And we now have access to so much more data and information, and a lot of macro data over time. And that's really what we need when we see slow and yet accelerating shifts and change over time. We need more data points. We need time series analysis. And so at Planet, one of our two major data products is we image the entire land area of the Earth every day. And we've been doing that for the last about 4 years. So we have about 1,400 pictures, snapshots of the history of the planet over the last 4 years. And so we're beginning to, we're partnered with NASA. They're one of our customers. So if anyone's listening, if you are a NASA employee or on contract by a science mission director, you can have access to all of that data to allow for you to look for essential climate variables and do time series analysis to then correlate that new data set that is globally explicit and also unbiased from the similar sensor family, then allows for much greater high resolution in spatial as well as in time to then understand a lot more about ecosystem shift and change and essential climate variables, or coming after what we're calling those indicators. And then when we have scientists on a common operating picture who have the same underlying data, it allows for the community to begin to get shared understanding and go further up the value stack. So it's a pretty it's a needed tool for society, for us to have a common operating picture around what's happening that's factual, and that also allows for our scientists to debate in open journals, and to then come up with much greater facts and understanding for what's happening on the planet. So our sector in remote sensing in particular plays a very important role for that macro level oracle data set for understanding what's happening on the planet and recording that history.
And I am really glad I don't have to pay your data storage bill. Walter, what about your view on this contributing to the understanding and management of climate change?
Well, first of all, kudos to space agencies like NASA and ESA and the sensors that they've been using for monitoring, doing precision monitoring of climate for decades. Robbie mentioned the Landsat program going back to the early 1970s, largest continuous record of imaging the Earth's surface that exists. And that's an important role for satellite, because at the end of the day, you have to make decisions on the basis of facts, not on the basis of anecdotes, not on the basis of opinions, And satellites have been essential for providing facts relative to observations of the Earth's climate. And the other nice thing about satellites is that you can perform measurements from space that are global in context, and which also allow you to measure things that might be difficult to measure from the ground. Like, for example, the amount of output that the sun is producing at the top of the atmosphere as opposed to at the bottom. There are other areas where satellites are important in understanding the effects of climate change and how we manage those effects. For example, identifying the risk of communities, particularly coastal communities, to whether it's extreme weather or ocean level shifts. Satellite provides a way to get that view from above that gives you a comprehensive view of the area, so that communities are able to base their plans on the basis of facts, not on the basis of fears, anecdotes, or opinions.
So, we've heard from our two experts on understanding, and the depth of understanding that we're beginning to be able to gain is truly awe-inspiring. Let's talk about the communications interface, where we actually bring, if you will, individual people and organizations and institutions into the loop. Valvanera, how do you see satellite services contributing to the understanding and management of climate change?
Yes, so I mean, I think that each of us have something that we can do to contribute, let's say, to manage the effects or to reduce the continuing growth of climate change. And that comes with the dissemination of information, right? So the awareness, getting all this data that all these other satellite systems are gathering and other ways. To get that to the public, that is very, very important, so that people can take action, and also getting the help of public figures like Greta Thunberg and others also helps on this dissemination, but satellites are behind the infrastructure to get to as many people as possible in the world, which we still have more than half of the world, but we need to cross that gap with the digital divide. So that's how I see the contribution of satellites.
Yeah, a nice example of that is the Explorer Mike Horn keeps going up to the Arctic and basically running a whole lot of real-time social media right out of his expeditions, and of course showing you how much of the Arctic is melting down and so forth. Yeah, it dramatizes it in a very powerful way. Matt, last word to you on this. Where do you see satellite services, contributing to the management of climate change?
Well, in many ways, in fact, a lot of our subscribers or devices on our network are helping contribute to that sort of thing, since the technology boils down to things that can go underwater or on the water. Underwater autonomous drones have been using Iridium for a long time to send and transmit their data to map the underwater areas of the world and to understand the climate as it relates to that. DARPA right now is just deploying something called the Ocean of Things, where they're deploying tens of thousands of free-floating drones on the world's oceans that are constantly measuring both where they are, what the temperature is, what's going on around them, etc. They use satellite to communicate their information in real time to create sort of a model of the temperatures and that sort of thing. When we were launched, we were the first sort of low Earth orbiting communication systems, and so we covered the poles for the first time. And in climate change, Arctic was real important. One of our competitors said all that was up there was polar bears and penguins, like that wasn't important. But we all know that those are pretty important things right now. And to have these monitoring stations in those areas, to have we've got supporting National Geographic, explorers right now. They're monitoring climate change in remote areas, and they're using satellites to deliver the data back in real time so that you can see these things happening. So communication technologies is really important in the evaluation of this, as well as other natural resources. I mean, we're being used to help the systems that are cleaning up plastic in the oceans, and well, that's not climate change. It's a pretty important ecological factor for fish and other things in our oceans, and we got to worry about those things as well. So I think you'll see tons of sensor technologies all over, helping to understand what's going on our planet, and satellites are the things that are delivering that technology back to people and scientists.
And I think that's a great place to leave this. Out of respect for our audience, I could keep going on this topic for quite a while because I find it fascinating. I mean, the picture that you get out of this is that we are surrounded by this invisible and increasingly indispensable web of services and data gained from space that is helping us. It's probably the most hopeful thing I've heard in a few weeks. There is so much going on that protects us, that extends life, that hopefully gives us tools to combat climate change and keep this world spinning on its axis the way we'd like it to be. So I want to thank very much Matt Desch, Valvanera, Moreno, Walter Scott, and Robbie Schingler for sharing their insights and their very in-depth knowledge with us today. This is the end of our webinar at this point. I want to thank you also, you who came in and joined us, who listened, who asked questions, and hope some of them answered. And we look forward to having you join us in our next webinar. So for SSPI and Satellites in Public Health, this is Robert Bell.